Coronavirus disease. What you need to know. We've come to a point where we are hearing something about this disease every single day. In fact, there's so much information out there, it's hard to understand what's actually going on. The aim of this course is to provide you information about COVID-19 and the virus that causes it, SARS-CoV-2, as well as ways to protect yourself. COVID-19 is a disease that's caused by a virus called SARS-CoV-2, which is one of several known coronaviruses. These viruses cause respiratory illness. Some of them only cause mild symptoms, while others can be more severe. These include SARS coronavirus as well as MERS coronavirus. The SARS-CoV-2 virus originated in Wuhan, China. The source of the virus seems to be related to the seafood and live animal market in Wuhan, but we don't yet know what animal it came from. The virus outbreak started with a group of people who exhibited respiratory symptoms. By now, it has spread to most parts of the world. While the confirmed cases keeps changing daily, current sources indicate that the total was more than 400,000 cases by mid-March of 2020. Individuals who have become infected with the virus will present symptoms such as cough, fever, and shortness of breath, and its severity can range from mild to a severe respiratory illness. Although 15 to 20% of those cases develop a serious illness, 80% of cases are expected to recover without special treatment. It's also important to note that in some cases, individuals may have the virus and not present any serious symptoms. Currently, the mortality rate is reported between 0.7 and 4% as of March 2020. It seems that the virus poses a greater danger to older populations, as well as people with pre-existing conditions. Same as any respiratory virus, SARS, or CoV-2, spreads from person to person through small droplets from the nose and mouth that can land on surfaces around you when you cough or sneeze. You can get infected by touching an infected surface and then touching your nose, mouth, or eyes, as well as breathing in droplets when an infected person coughs or exhales near you within 6 feet or a 2-meter radius. The symptoms of COVID-19 range from mild to severe. The most common symptoms are fever, tiredness, cough, sore throat, and shortness of breath. Symptoms may appear 2 to 14 days after exposure to the virus. Currently, there is no treatment for this disease. However, infected people should receive medical care to relieve the symptoms. Potential vaccines and drugs are being developed and tested, but this will take time. If you suspect that you have COVID-19, immediately contact your healthcare provider. The first and foremost protection against the virus is right in the palm of your hands. Quite literally. Here are some simple tips for protecting yourself and others from the virus.
The first and foremost protection against the virus is right in the palm of your hands. Quite literally. Keeping them sterile as possible prevents the spread of viruses, germs, and many other diseases to others. Although basic, knowing how to properly wash your hands is essential to avoiding the spread. To properly wash your hands, first wet them with hot water comfortable to the touch. Although hot water does not kill the bacteria, it is more effective than cold water in removing the oils which harbor it. After that, apply soap to your hands. Whether you have plain soap or antibacterial soap, both are equally effective at cleaning your hands if used properly. Liquid or bar soap are also okay to use. Now lather your hands. Remember to include the back of your hands, between your fingers, under your fingernails, and under your rings. Be generous with your lathering to lift dirt, grease, and other microbes. After that, scrub generously. This is the most important step and often the most overlooked. The CDC recommends washing your hands for at least 20 seconds and scrubbing should be more of that time. Humming the happy birthday song twice is roughly the length of time you should be washing and scrubbing your hands. After scrubbing, rinse your hands. It is important to rinse properly to remove traces of oil, grease, and other microbes. Lastly, dry your hands using an air dryer or a clean paper towel. If you are in a public place, consider using a paper towel to open a door and turn off the faucet, as these objects are frequently touched and could be contaminated. Use hand sanitizer that contains at least 60% alcohol if soap and water are unavailable. Following these steps are crucial, especially after blowing your nose, coughing, sneezing, going to the bathroom, handling trash, or touching things in public. Coronavirus disease 2019, or COVID-19 for short, spreads from person to person via respiratory droplets originated by a sneeze or a cough from an infected individual in close proximity, about 6 feet. As these droplets fly through the air, they can be inhaled through the lungs, or they can fall on objects and surfaces around you. Touching an infected surface has the potential of infecting you if you touch your mouth, nose, or eyes, which is why good hygiene practice is highly recommended. Another measure encouraged by the CDC is practicing social distancing. Social distancing is abstaining from congregating in public settings, avoiding mass gatherings, and maintaining a distance of 6 feet from others whenever possible. Without social distancing, infectious disease can spread from person to person relatively easy, resulting in an exponential increase of cases from a disease, in this case, COVID-19. By working from home, not going to a party, postponing a trip, and buying online, we can help the cause of reducing the spread of this virus. Remember to stay vigilant for people showing symptoms of illness like a fever or a cough, and remember to practice social distancing as much as possible. In addition to washing your hands and practicing social distancing, the following measures are key to protecting others should you feel ill or even if you don't. Cover your coughs and sneezes using the inside of your elbow. Stay home if you feel sick. Have tissues at hand and dispose of them after each use. Follow state and local health authorities' recommendations. Avoid using colleagues' phones, desks, offices, and other work tools and equipment when possible. Keep a safe distance among and between coworkers, 6 feet or 2 meters. Avoid non-essential travel and public transportation. Use non-contact methods to greet people in the workplace. Use the back of your hand or elbow to push elevator buttons. Knowing how to spot an illness is key to avoiding further spread of the virus in those around you. Be sure to monitor any symptoms such as a fever, coughing, shortness of breath, persistent pain or pressure in the chest, confusion, tiredness, and bluish lips or face. If you think you may have been exposed to COVID-19, be sure to call your healthcare provider. If you're unable to stay home, the following will ensure you are doing everything in your power to maintain a healthy work environment for you and those around you. Maintain regular housekeeping practices like routinely clean and disinfect surfaces, PPE, and other equipment. Different materials may determine how long COVID-19 can live outside the human body. For instance, the virus can live up to 24 hours on wood and cardboard, and up to 72 hours on stainless steel and plastic. Although it is unclear how long the virus can live on fabric, the CDC recommends washing clothes using the warmest appropriate water setting and making sure to dry them completely. For any surfaces that need to be cleaned manually, the CDC recommends mixing 1 cup 240 milliliters of bleach in 1 gallon, 3.75 liters of water. Use a detergent or soap prior to disinfecting a dirty surface. Soap or detergent does not need to be labeled as a disinfectant to be effective in killing the COVID virus. Note: to decontaminate a surface, you can't just swipe it. You've got to scrub it until the entire surface is wet, and then let it dry on its own. The force that you put into the cleaning process, along with the soap or detergent, will break down the protective coating around the virus, effectively rendering the virus dead. Products with EPA-approved emerging viral pathogen claims are also expected to be effective against COVID-19. When disinfecting surfaces or PPE, wear disposable gloves, which should be discarded after each cleaning. If reusable gloves are used, those gloves should be dedicated solely for cleaning and disinfecting equipment that may have been exposed to COVID-19. N95 FFR respirators may be used during work, but are not recommended outside of work. Be sure to wash or sanitize your hands before putting on the respirator. And facial hair should be removed if it interferes with the seal of the respirator. If possible, take your temperature every day before you leave your home to ensure you are safe to be at work or around others. Employers should also be taking steps to limit the spread, including emphasizing basic infection prevention measures such as promoting frequent hand washing, providing trash receptacles, discouraging or stopping shared work equipment and desks, as well as maintaining regular housekeeping practices. This includes routine cleaning and disinfecting of surfaces, equipment, and other elements of the work environment. Employers should also develop policies and procedures for prompt identification and isolation of sick people, if appropriate. Refer to OSHA.gov or the World Health Organization for more information on this and other policies aimed at limiting the spread of COVID-19.
COVID-19 is still very new, and the data keeps changing every day. There's no need to panic, but it's also wise to stay informed. Make sure to look for updates from reliable sources. Think critically, especially when it comes to information that you see on social platforms. Sharing unreliable medical information is very irresponsible and dangerous. We hope you found this course on COVID-19 helpful. If you would like an interactive version of this course, including a knowledge check to provide to your workforce, please contact your Avetta representative to learn more. From the Avetta family to yours, stay safe and wash your hands.